Today, my
Good
topic
evening.
is on iatrogenic complications of anesthesia. So, what do we mean by iatrogenic complication? It is harm, hurt, or damage that results from activity of a doctor that is induced by a physician or by a medical treatment. It includes physical injuries, adverse drug reactions, drug errors, that is like giving wrong dosage or having mislabeled drug and giving it, equipment failure, that is disconnection of a circuit or ET tube. The root cause of these iatrogenic complications is due to the complexity nature of anesthesia work, lack of communication, negligence, human-related errors, and error due to medication administration. Some of these iatrogenic injuries are difficult to avoid, in particular adverse outcome or drug reactions like anaphylaxis. Coming to the complications following anesthesia, airway injuries are most common following airway instrumentation. That is, dental injuries are more common during laryngoscopy. Absent teeth noted by anesthetists should look into a chest X-ray to rule out aspiration. Injuries to the lip, oral mucosa can occur if during laryngoscopy or during insertion of a LMA or airway. Sore throat is the most common incidence following any insertion of LMA. Rarely, esophageal perforation can occur due to the insertion of the Ibuji introducer or ET tube. Post-operative nausea and vomiting is the leading cause of patient dissatisfaction occurring after anesthesia. It can be avoided by giving prophylactic therapy or avoiding alternative drug. Awareness during anesthesia can occur following general anesthesia, where the patient will be paralytic, but they are aware of their surrounding. They usually don't feel pain, but in rare instances, they may feel pain. This can be avoided. This should be avoided, and the patient may develop psychological issues like post-traumatic stress disorders. Accidental kinking or disconnection of the ET tube or circuit case noted. In intraoperatively, we may notice due to induction of anesthesia, there may be hypertensions, arrhythmias, bronchospasm due to blockage of tube with secretions, blood clot, or foreign body. Eye injuries, corneal abrasions are more commonly seen. It is extremely painful. The anesthetist should ensure that the eyes are fully covered in order to avoid exposure keratitis. Direct trauma from objects like face masks, laryngoscopes, drapes can occur. So chemical injury can also occur due to cleaning materials which are split into the eyes. It can be prevented by manual closure of eyelids, taping the eyelids, use of eye ointment. Prevent having any mechanical pressure to the globes. Avoid using horseshoe headset, which is used in prone position, which can cause retinal ischemia and can rarely cause blindness. Nerve injuries. Peripheral nerve injuries can occur following nerve compression or due to direct needle contact. That is due to improper technique of regional anesthesia. The commonest cause is due to poor patient positioning. Most commonly, like superficial nerves like ulnar and peroneal nerve are most commonly damaged. It can be avoided by padding the pressure points. If nerve injury is suspected, evaluate and do an electromyography. Following in regional anesthesia, high injection pressure and use of long bevel needles can damage the nerves. And following central neuraxial blockade, multiple attempts can increase the likelihood of nerve damage, can lead to neurological complications. Even foot drop can occur. Iatrogenic complication following regional anesthesia has been reduced drastically due to the utilization of ultrasonography. Other iatrogenic complications includes bleeding, hematoma, intraarterial injections, etc. Not following aseptic precautions can increase the risk of injection, and accidental dural puncture due to a technical accident can give rise to a post-dural puncture headache. Some of the human errors noted like can be avoided by before performing any procedure. Call out the patient's name to avoid patient mismatch, and side and side of the procedure to avoid performing a procedure or block in the wrong side. Avoid avoid having a syringe swab to avoid drug contamination or blood contamination. So in conclusion, efforts can be made in reporting and preventing the medical drug blenders. Proper vigilance and high standard of practice is required. Anesthetists should be aware of these possibilities and use strategies to minimize the risk of the patient. Thank you, sir.
Okay. So this is a topic which was asked 2 or 3 times in the theory exams. And none of the books have this topic separately as a answer for those questions. So you have to prepare the answer from your experience or your common thinking of what are all the mistakes that a physician or an anesthetist can do to cause damage to the patient. So prepare the answer